नमस्ते बेटिया, हमेशा खुश रहो। Today's topic is polycystic kidney disease. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine in Faculty of Homeopathy Science at JAYOTI VIDYAPEETH Women's University. This is the lecture which is a part of the series of urogenetics system, and in today's topic we will be discussing about the polycystic kidney disease, its etiology, its clinical feature, investigation and management. So what is polycystic kidney disease and why it happens, and what are the clinical features, investigation and management we are going to discuss in today's lecture. So let's start with polycystic kidney disease. As the name suggests, polycystic kidney disease means there are a lot of cysts that are formed in the kidney, multiple cysts that are formed in the kidney. The image shows a normal kidney, and then the first stage, second, third stage, as the number of cysts are increasing, the kidney size is increasing, and we are going to discuss all these things in the upcoming slides. So the polycystic kidney disease are the group of genetically heterogeneous disorders and the leading cause of kidney failure. So the polycystic kidney disease, it is a genetically heterogeneous disorder, means it is managed by the genetic factor. Genes are responsible for the development of polycystic kidney disease and is a leading cause of kidney failure. It is a main cause of kidney failure. It is of three types depending upon the genetic factors, like ADPKD, that is autosomal dominant, ARPKD, that is autosomal recessive, PKD is polycystic kidney disease. Alright, so AD is autosomal dominant PKD, polycystic kidney disease. AR is autosomal recessive PKD, polycystic kidney disease, and ACKD is acquired cystic kidney disease. So the autosomal dominant form of polycystic kidney disease is the most common life-threatening monogenic disease. It is the most common type of monogenic disease, that is autosomal dominant form of polycystic kidney disease. The autosomal recessive form of polycystic kidney disease, ARPKD, is rarer, but it affects the pediatric population. So autosomal recessive is a basically rare variety, and it affects usually the pediatric population. Why it is rare? Because the children who are affected with it do not grow older to become an adult. So acquired cystic kidney disease develops in association with long-term kidney problems, especially in the patient who have kidney failure and who have been on dialysis for a long time. So acquired means that has been acquired later in the life. So acquired kidney disease happens because of some other kidney-related disorder due to which the patient is taking dialysis, especially the chronic kidney failure. In such a case, the patient is having a regular dialysis in the hospitals, due to which the patient develops acquired cystic kidney disease, ACKD. Polycystic kidney disease is characterized by progressive formation of epithelial lines, cysts in the kidney. There are multiple cysts that are formed in the kidney. Epithelial line cyst in the kidney formation takes place, and the enormous growth of these cysts ultimately leads to the loss of normal surrounding tissues. Due to the formation of the cyst, the normal surrounding tissue of the kidney loses its normal shape, and loss of renal function takes place. Because of the cyst, the kidneys are not able to function properly, due to which their normal function gets disturbed. The cellular defects are increased cell proliferation and fluid secretion. There is decreased cell differentiation, and third one is abnormal extracellular matrix. So the cellular defects that are commonly seen in the cases of polycystic kidney disease are increased cell proliferation and fluid secretion. Because of greater degree of proliferation of the cells and fluid secretion, the cyst formation takes place. There is decreased cell differentiation. The cells are multiplied in a rapid rate, but they are not differentiated. And abnormal cellular matrix that is formed in the kidney. Now, this is the X-ray of basically X-ray finding of the polycystic kidney disease. Now, what are the clinical manifestations? The clinical manifestation for which the patient is coming to us, the sign and symptom which he is presenting to us when he is coming to show As for the polycystic kidney disease, ADPKD is autosomal dominant polycystic kidney disease. It is characterized by progressive bilateral formation of the renal cysts that we have just seen in the X-ray in the previous slide. So there are progressive bilateral formation of the renal cysts, multiple cysts that are formed in both of the kidneys. Hundreds and thousands of cysts are usually present in the kidneys, and most of the patients usually in the fifth peak. So there are n number of hundreds and thousands of cysts that are formed in both of the kidneys, and most of the patients usually in the fifth peak. The enlarged kidneys can each reach a 4-fold size in the length and weighs up to 20 times the normal weight. Remember the first figure that we have seen when starting this topic, there was increase in size of the kidneys, which I told you have been discussing later. It was shown that the normal kidney becomes even 20 times greater than its normal size due to the formation of ventricular cyst. So the kidneys enlarge, each reach 4-fold increase in the length. इसकी जो लेंथ होती है उस पर 4 गुना तक बढ़त हो जाती है एंड वेट अप टू 20 टाइम्स. जो किडनी का वेट होता है that increases 20 times the normal weight of the kidney. The clinical presentations are highly variable. The clinical presentation with which a patient is coming to us is highly variable. Many patients are asymptomatic until the 4th and 5th decade of life. Although this is autosomal dominant और कम एज में ही ये शुरू हो जाता है, लेकिन but still many patients who are coming to us are asymptomatic. They have undergone some investigations due to some other problem, and they found out suddenly that they are having polycystic kidney disease or multiple systemic kidneys, both of the kidneys, and they are totally asymptomatic. The diagnosis is incidental discoveries, so it becomes basically incidental or accidental discoveries. Accidental discoveries in the cases of hypertension. In hypertension, we always advise for getting a renal scan done or ultrasonography, especially for any abnormality in the kidneys. Abdominal masses. There are some abdominal masses for which you have done certain investigations, and you find out that the patient is having polycystic kidney disease. The patient is having back or flank pain. So for that, the patient is coming to you and you advise ultrasonography, and you suddenly found out that this is the patient of polycystic kidney disease. The pain results from renal cyst infection. The pain is coming in the cases of renal cyst disease. It comes from renal cyst infection. When the renal cyst gets infected, it causes pain. The infection can become severe, and it can lead to hemorrhage and nephrolithiasis, the formation of stone in the kidney again. So, other clinical manifestations include gross hematuria. Why the gross hematuria is occurring? Because of the rupture of the cyst. When the cyst ruptures, it leads to excessive bleeding from that particular portion and leading to gross hematuria that occurs in 10% of the patient with recurrent episodes. The patients having recurrent episodes, when the cyst ruptures, it causes gross hematuria. The flank pain and hematuria coexist if the cyst that ruptures is connected with the collecting system. So if the cyst is rupturing in the collecting system, there is flank pain and hematuria, both are coming together. Proteinuria is a minor feature. So there is no proteinuria or very mild proteinuria that is visible in the case of polycystic kidney disease. Infection is the second most common cause of death for the patient with ADPKD. Always remember, with ADPKD, autosomal dominant polycystic kidney disease, infection is the second most common cause of death in the patients. Cardiovascular complications are the major cause of mortality. So, after cardiovascular complications, infections are the second most cause of disease in the cases of ADPKD patients. An infected cyst and acute pyelonephritis are the most common renal infection. So the cyst can become infected, and there can be acute pyelonephritis in the renal regions that are associated with fever and flank pain. The patient complains of fever, and there is a flank pain with or without bacteremia. What are the different complications that can occur due to the cases of polycystic kidney disease? The complications and renal insufficiency often correlate with a structural abnormality. So, whatever abnormality the cysts are producing in the kidney, accordingly the complications are coming. So, the complications and renal insufficiency often correlate with the structural abnormality of the renal parenchyma. The renal parenchyma, the changes that are occurring in the renal parenchyma, it is causing the complications accordingly. Kidney stones occur in around 20% of the patients with polycystic kidney disease. More than half of the stones in the patient with ADPKD are composed of uric acid. So, uric acid that we discussed in the just previous lecture, They were basically due to uric acid for excessive uric acid in the blood circulation, and they were radiolucent stones, with the remainder due to calcium oxalate. So calcium oxalate was very common, and polycystic kidney disease can also lead, is also responsible for the development of stones in the kidney, like uric acid stones and calcium oxalate stones. Hypertension is another very common manifestation. So first of all, the manifestation that was leading to death was cardiovascular disease. Second was infection. Due to infection, it can present with a flank disease. All right, there can be hematuria. There was proteinuria to a lesser extent. Hypertension is another common clinical feature in the cases of polycystic kidney disease, and typically occurs before any reduction in the glomerular filtrate rate. Before occurring any decrease or reduction in the glomerular filtrate rate, you see the hypertension. Hypertension is a risk factor for both cardiovascular and kidney disease. So hypertension, if a person is coming to you with the complaints of hypertension, you should always think of cardiovascular disease and kidney diseases. Other important complications include intracranial aneurysm (ICA) that occurs in 4 to 5 times more frequently due to the defect of arterial smooth muscles, and myofibroblast that causes high mortality. So ICA or intracranial aneurysm is another very important cause of death due to the cases of polycystic kidney disease. And lastly, liver cyst. The complication liver cyst can be derived from the biliary apithelia. These are most common extrarenal complications. So due to the cystic kidney disease, a cyst can also be formed in the liver that will be presented as liver cyst. So this is an extrarenal complication of the cases of polycystic kidney disease. Now, what are the risk factors? Who are the people who are most to develop the kidney disease? As it is managed by genetic factor, that is autosomal dominant gene ADPKD and autosomal recessive gene. Most commonly in the adulthood we see autosomal dominant PKD, polycystic kidney disease, but also acquired disease is there. So what happens? How does the person acquire this polycystic kidney disease? What are the different risk factors? Who all are the people who are at the greater risk of getting affected by polycystic kidney disease? So early diagnosis of ADPKD. If a person is diagnosed with ADPKD in a very early life, then there is a great risk of danger to his life. The patients with hypertension, they are at risk because it can lead to various complications like kidney failure, or hypertension can lead to kidney failure, or it can also lead to cardiovascular failure. Gross hematuria, because it is representing the cystic rupture, multiple pregnancies. There are certain factors, certain hormones that are responsible for the complication in cases of multiple pregnancies for polycystic kidney disease. Large kidney size, the greater the size, the greater number of cysts you can see in a particular kidney. And the disease can present as an early in utero, but end-stage renal disease typically occurs in the middle stage. So it can even end in end-stage renal failure. And now, how will you diagnose the cases of polycystic kidney disease? So if a person is coming to you and you have to diagnose the case of polycystic kidney, what are the various steps that you are going to take in order to diagnose the cases of polycystic kidney disease? There will be a positive family history. You will always find a positive family history in the cases of polycystic kidney disease. Then second method, you can perform a renal ultrasonography in which you can see the presence of the cyst, multiple cysts, hundreds and thousands of cysts are visible. CT scan can be done and T2-weighted MRI can be done with or without the contrast enhancement. For these are more sensitive investigations to observe the cyst in the embedded into the kidney. The genetic testing by linkage analysis and mutational analysis can be done to check in the very earlier stages that is the person susceptible for developing polycystic kidney, or when the doubt there is a doubt, it can be genetic testing by linkage analysis can be done. How will you manage such a case? It is very difficult to manage such a case of polycystic kidney with hundreds and thousands of cysts present in the kidney. So no specific treatment is to prevent the cyst growth of the or to decline or the declining renal functions. So there is no specific treatment for to reduce the formation of new cyst and to reduce the progress of declining renal functions. So we can what we can do is that we can reduce the other symptoms like hypertension. The patient of hypertension, we can try to reduce the blood pressure of the patient in order to prevent further damage. The blood pressure control to target 140/90 mmHg. The treatment of kidney stone. If the stones are formed, especially nephrolithiasis, we have to treat for those stones, analgesics for the pain relief, and hydration to ensure adequate urine flow. We have to ensure that the urine flow is adequate, otherwise the patient will go into end-stage renal failure. Surgical decompression of the cyst can be done, but this has a very limited role in the cases of multiple cysts. More than half of the ADPKD patients eventually require peritoneal dialysis because the kidneys are not functioning properly. Hence, sooner or later they have to be switched to the peritoneal dialysis, hemodialysis, or the kidney transplantation has to be done because of the reduced kidney functioning. The large polycystic kidney and recurrent renal cyst infection may require pre-transplant nephrectomy. So, if there is an infection associated with the polycystic kidney disease and you are trying to go for the kidney transplant, and before the transplant you have to go for if there is any kind of infection, any sort of infection, then you have to do a pre-transplant nephrectomy or bilateral nephrectomy to remove that particular portion of the cystic kidney. Specific treatment strategies for ADPKD have focused on slow renal disease progression and promoted cardiovascular risk. So the only treatment that is left with us is that we have to slow down the progress of the disease. All the measures are taken into consideration that can slow down the progress of the disease or which can reduce the complications that are occurring on the cardiovascular system or on the renal system. So we have to reduce the blood pressure. We have to make proper hydration. We have to ask the patient to make the proper hydration possible so that the urine flow can be normal and the other impurities should not accumulate in the body and prevent further damage to the kidneys and other organs of the body. So, homeopathic management. Homeopathy offers a very good role in the cases of polycystic kidney, although this is a pathological condition and we have a certain kind of limitation in such cases, but still there are certain medicines which can give symptomatic relief to the patient. Although in all the cases, I always advise constitutional medicines. The proper tasting has to be done, and according to the whole totality of the symptoms, evaluation, analysis, evaluation, reportization, a proper homeopathic medicine has to be selected and to be prescribed to the patient based on totality of symptoms on the basis of constitutional symptoms. But certain medicines provide a very good role in the acute phase, which include aconite, which is given in the incipient state of post-scarlet nephritis, when there is extreme pain, fear of death, restlessness, great thirst, and quenchable thirst for large quantity of cold water, scanty urine without blood. Apis mellifica, when there is edematous swollen condition in the body, there is swelling on the face and extremities, there is paleness, ascites, edema, and pulmonum, the pain in the head and back and limbs. Apocynon cannabinum is related for paroxysmal conditions where the urine is scanty, and also for the coma and convergence in the nephritis of pregnancy. Belladonna is a very good medicine for reducing the inflammation of the kidney, piercing pains in the lumbar region. Cantharis, another very good medicine for the inflammatory state or infections in the kidney. Nephritis with cutting pain in the lumbar region and urine is passed in drops. The urine scalds, burns when passing, and is mixed with blood and much urging. Convallaria majalis. This is a medicine with nephritis from the heart disorder. Gloline is a medicine which is given for the albuminous urine and used in acute and hemorrhagic nephritis. Plumum is another very good medicine for granular regeneration of the kidneys. And there are very lot number of medicines that are also useful, but due to shortage of time, I cannot discuss all the medicines here. And I always prefer the constitutional medicine to be given in the cases of in all the cases of that are coming to you, especially in the cases of chronic diseases and incurable diseases. So this was all about polycystic kidney disease. In the next lecture, we will be discussing about benign prostatic hyperplasia. That is also a very good, very common disorder of the old age. You will see a lot of patients of BPH coming to you, and homeopathy provides a wonderful relief to such patients. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention it in the comment box and try to solve it. So thank you very much. This was all for today. We will meet in the next lecture tomorrow. So this was Dr. Ravi signing out for now. Have a great day.